Counselling on HPV vaccination. What is the HPV virus? Human papillomaviruses, HPVs, are small, non-enveloped capsid viruses. They are common and can cause infections in both men and women. HPV infections are usually cleared by our bodies on our own within 1 to 2 years, but if they do persist, they can cause cancer over time. It is transmitted via skin-to-skin contact, such as during sexual activity. There is no treatment for HPV infection, and it is usually cleared by our own immunity. The best way to prevent it is by primary prevention, which means to be vaccinated against it. What cancers can they cause? HPV infections can cause several cancers in both men and women. In women, 99% of cervical cancer is linked to cervical infection with HPV. It can also cause vulvar and vaginal cancer. In men, HPV can cause penile cancer. In both, HPV can cause mouth, throat, and anal cancers. It can also lead to non-cancerous lesions such as genital warts in both men and women. Who is at risk? HPV is a common skin infection. However, the risk of infection is higher for individuals with 1. Increased exposure. The greater the number of sexual partners, the higher is your risk of getting an HPV infection. Having sexual activity at an earlier age and with a partner who has multiple sexual partners can also increase your risk. While condoms can reduce the risk of HPV infection, it will not guarantee 100% protection. It will, however, also help in preventing you from getting any other sexually transmitted infections. 2. Decreased immunity. Individuals with weakened immune systems, for example, secondary to HIV infection, or if they are on immunosuppressive agents for chronic diseases like SLE, systemic lupus erythematosus, are also at higher risk of HPV infection and persistence of HPV infection. 3. Other risk factors include smoking, which will also increase your risk of HPV infection. What is the significance of the HPV virus? Cervical cancer is the 10th most common cancer among women in Singapore, with almost 100% of cases being attributed to the oncogenic types of the HPV infection. Types 16 and 18 are found in up to 70% of all cervical cancers. Oncogenic HPV is also implicated in the development of other cancers, including tumors of the vulva, vagina, anus, penis, and the head and neck. Although non-oncogenic, HPV types 6 and 11 account for 90% of genital warts. Vaccinations. 1. What are the types of vaccinations available? At present, 3 HPV vaccines are available in Singapore. A. Cervarix protects against HPV 16, 18 and can be used in females aged 9 to 25 years old. B. Gardasil protects against HPV 6, 11, 16 and 18 and can be used in both females and males aged 9 to 26 years old. C. Gardasil 9 protects against HPV 6, 11, 16, 18, 31, 33, 45, 52 and 58. Can be used in both females and males aged 9 to 45 years old. 2. How effective is it? The HPV vaccines are highly effective. Large trials have shown that they are very effective against HPV 16 and HPV 18 related precancerous lesions. 3. Is it safe for me? All 3 vaccines are well tolerated by most and have a good safety profile with no documented serious adverse events. Common side effects are generally local, including pain, swelling, itchiness, redness at the site of injection. 4. How many doses should I get? Aged 9 to 14 years old, Cervarix or Gardasil 9, 2-dose schedule at 0 and 6 months. Aged 9 to 26, Cervarix 3-dose schedule at 0, 1 and 6 months. Gardasil or Gardasil 9, 3-dose schedule at 0, 2 and 6 months. At present, no boosters are required. Cervical screening program. I've been vaccinated. Do I still need to get my cervical cancer screening done? The HPV vaccine is not a substitute for cervical cancer screening. Women aged 25 years and above who are sexually active or who have ever had sex must continue with cervical cancer screening, HPV DNA test, or pap smear, regardless of their HPV vaccination history. The screening program differs according to age as well as depending on whether they have any other significant risk factors. Pap smears are used for screening for women aged 25 to 29 years and have engaged in sexual intercourse or are sexually active, while HPV test is done for women aged 30 to 69 years and have engaged in sexual intercourse or are sexually active. Special scenarios. I'm currently younger than 26 years old but am already sexually active. Can I get vaccinated? Yes. Ideally, the vaccine should be given before the onset of sexual activity, as it will not protect against any pre-existing HPV infection. However, sexually active women can still get vaccinated, although the vaccine may be less effective compared to women who have had no previous HPV exposure at the time of vaccination. I'm currently 27 years old now. Can I still get vaccinated? Yes. Women older than 26 years of age can be offered HPV vaccination. Gardasil 9 has been approved by the FDA and HSA for use in women and men aged 27 to 45 years old. The benefit received from HPV vaccination in women older than age 27 may also be limited if they have been exposed to HPV infection previously. For example, if they are already sexually active or have previous abnormal cervical cancer screening results, which may or may not have required treatment. Should I get HPV testing done before I get vaccinated? No, it is not necessary to be tested for HPV DNA prior to vaccination. 4. I have had HPV infections previously and also previously diagnosed with CIN. Can I still get vaccinated? Yes. Women with current HPV infection, current or previously treated cervical precancer can get vaccinated. It can also reduce the risk of recurrence of cervical precancer in women who had previous treatment for that condition. However, it does not treat the existing HPV infection or cervical precancer. These patients will still need to continue follow-up as recommended by their physicians. 5. I'm immunocompromised and am on medications. Can I still get vaccinated? Yes. Women who are immunocompromised, example on steroids, immunosuppressant medications, or have HIV infection can be vaccinated. However, their immune response to the vaccine may not be as good as compared to those women who are not immunocompromised. In addition, regardless of age, it is recommended that the 3-dose regime is used. 6. I'm currently pregnant and fully intend to breastfeed. Should I get vaccinated now? The HPV vaccine is not currently recommended for use in pregnancy, and vaccination should be deferred till after the pregnancy is completed. It is safe for breastfeeding as the vaccine does not contain a live virus. 7. I'm a male and would like to get vaccinated. Can I do so? Yes, the Gardasil 9 vaccine is approved to be used in Singapore for males aged 9 to 45 years old. Thank you for watching this video. This video is presented by Yong Lu Lin School of Medicine's Department of Obstetrics and Gynecology. For more videos like this, head on to the National University of Singapore's website.